Let's see if I can. We are going in a couple seconds, apparently. We are now live.
Awesome.
All right. Oh. Alrighty. So let's share this link. This is cool. This is the first time I've ever done one of these live broadcasts.
I've never done one like I don't know what the hell's going on right now. I'm just here. I don't know. You're on Twitch, you say?
I'm glad. No, so this is I put the link on Twitter. I'm glad that you're as new as I am.
Yeah, I am.
So
let me go on Twitter.
All right, I'm going to share the link with you. This is the very professional beginning of our live video conference.
Did you send me the link?
Yeah, and I also tagged you a couple times. There you go. Okay. So, Isiah, thank you for speaking with me today. I know that with between the campaign and the health stuff that's been going on, it's difficult to sort of process everything, and sitting down and having these conversations is, I think, important to for people. So why don't you tell me a little bit about how is this pandemic, how has COVID-19 affected you as a candidate for the U.S. Congress?
As a candidate, it's meant we've had to shift our complete operation to online. Forgive me because I'm still a little short of breath, so if I take time to breathe. Not door to door, but in person is the way that you reach voters the best. And we can't do that anymore for obvious reasons. So it's become a challenge for all grassroots candidates to try to connect with people and show our passion and fight and fire. But we can't do it in person. So that's been really hard. Fundraising is even harder because right now folks don't even know if they're going to get a paycheck. And I totally understand. Listen, if I had $27, that $27 could be, a meal for, the next few days or to donate to a congressional candidate. I understand why folks are like, you know what, I'll keep my $27. So it's made everything more difficult. But the problems that we're facing are difficult, number one, and they're not going to go away just because, we feel bad or we decide to quit. So we must fight on. So just try to use the tools at our disposal to keep fighting.
So digital campaigning is obviously, it's obviously difficult. It's obviously got a learning curve to it. Have you found, do you think that this will advantage or disadvantage progressive upstarts like yourself in races?
It will disadvantage. It always disadvantages upstarts because incumbents can raise more money. An incumbent is still getting donations from corporations. Think about it. The corporations donated to the incumbents before the pandemic. The incumbents just voted for a huge, massive bailout to the same corporations that they get money from. So they're getting the donations from those corporations. And an incumbent can spend $500,000 on mailers in, the next couple months. I don't know many progressive challengers who have $500,000 to spend on mailers, and text banking and phone banking. So it always disadvantages the challenger. But like I said, we have to keep fighting. We have to use the tools at our disposal now. Taking things digital is the space that young incumbents operate in, even though we're two young folks and we're having a hard time with this thing. But it's the space we're more familiar to operate in. So that could be to our advantage, but on the face of it, it disadvantages progressive challengers.
So in the last couple of days, you've been to the hospital.
Yes.
What was your experience there like?
Scary. You know what I mean? Like getting out of the car and walking into the hospital, knowing that, my wife can't come in with me because she's immunocompromised. Am I going to see my wife again? Am I going to be intubated for the next 2 weeks and not, I don't know what the hell, so many things were running through my mind. So it was scary, but seeing how hard the nurses and the doctors and the staff are working, it's both comforting and maddening because they should have so much more than they have right now. I mean, they couldn't give me the COVID test because I didn't present with a fever. So they reserved those for folks who are presenting with fevers. But they did a complete lab workup on me. They did a CBC, which is a complete blood count. They took, not only that, they did a culture test. They stool sample, urine sample, EKG, chest x-ray, everything. So I'm waiting for the doctor. And if you don't, once my levels came to normal, they discharged me. And they told me to go home and rest and do all this stuff. And one of the doctors called me yesterday and it said he's going to consult my primary care physician and they're going to call me again on Monday. And then they also, because I was having a lot of gastro issues, which has been one of the symptoms of the thing. And they want to send me to a gastroenterologist, but they can't do it for another 3 months because of everything that's going on in the hospital. So he's like, in 3 months, we can have you in. I was like, I'm supposed to suffer with this stuff for 3 months? But I understand, but the hospital workers they're busting their ass. They really, truly are. And our government is just failing it. I don't understand. Like, the president has the Defense Reduction Act. You know what I mean? I tell folks in World War II, we were churning out one B-24 bomber every hour. An entire bomber was coming off the assembly line every hour. Surely we can use the Defense Production Act to mobilize manufacturers to produce ventilators and PPE. But what's happening now is the federal government is sending PPE to private companies so they can then sell it to the hospitals. It is the most ludicrous and disgusting thing I have ever seen. And history will judge these people, and it will not judge these people kindly.
And who do you hold responsible?
The federal government.
But do you see this as an administration problem or a Congress problem or Senate?
The entire federal government.
The entire.
Listen, let me tell you something right now. This is a nation of 327 million people. There are 435 members of the House, 100 members of the Senate. That's 535 people. That's more than, they're more than that on 3 subway cars. This is a small group of people. They are our leaders. Anybody knows, in a time of crisis, leaders are supposed to lead. They are not leading on any front. Look, what the hell? Congress is on recess. Think about that right now. They are on recess. They are not in Washington dealing with this crisis. They're away. They can change the rules so they can remote vote online and all this stuff. But they need to do something. They don't need to be on recess right now, out talking and courting donors. They need to be getting to work, solving this problem. They should be reaching out to folks all across the world who haven't been hit as hard, trying to procure as much equipment as we can possibly find. Members of Congress have power too. They need to they should be sending up more and more bills to the president for relief, for aid, for states, for folks who they should be putting rent on suspension and canceling all these. There's so many things they can do that they're not doing.
And do you see anybody in government who is, taking the lead?
1 second. Yes, I see some folks who are stepping up. Governor Cuomo's he's stepping up and asking for stuff. But on one hand, the budget that just passed, they want to cut healthcare funding for some of the poorest hospitals in New York State. So there are folks who are like AOC speaking out. Bernie Sanders is obviously speaking out and trying to lead the charge. But we need more than that. We have a very powerful industry in this country. We need to mobilize it quickly because people are dying needlessly.
I wanted to talk to you a little bit about industry and manufacturing, because as you know, manufacturing has been sort of treated as an industry of the past, that manufacturing is no longer as important as it once was, that other countries like China are more suited for manufacturing, and in 21st century America, ideas are currency. And as we've seen, our hospitals now face a shortage of things like N95 masks and ventilators, things that are made in China. And of course, China was the first country hit by the coronavirus, the novel coronavirus that causes COVID-19. So, I mean, how do you shift an entire global economy? How do you change an entire global economy to deal with something that arguably we shouldn't be in this position in the first place, but we are? So what do you do if you're elected to Congress to remedy this situation that you're seeing today?
Well, are you talking about how do we shift the economy right now to deal with the pandemic?
How do we bring back, I mean, do you see a need to bring back manufacturing
Absolutely.
capability? And then how do you do that?
Well, we do that by getting rid of these disastrous trade deals. We do that by bringing manufacturing jobs back to this country. Instead of us, we tax the hell out of companies that ship jobs overseas. If you're an American company that's based in America, why are you manufacturing your stuff in Mexico? Why are you manufacturing it in China? Why are you manufacturing it in Singapore? You're doing that because they have lower standards of wages. They have lower standards for employees. They have all these things. So you take your jobs over there because you don't have to pay taxes. So, but you reap the benefits of the manufacturing because you sell those products around the world. If you're an American-based company and you don't have at least 51% of your manufacturing in this United States of America, then you get taxed at a crazy rate. You get taxed at 70, 80% until you bring your manufacturing back here. We are the leaders in the world on the economy. Folks have to play by our rules. We don't have to play by GE's rules. We don't have to play by Carrier's rules. We don't have to play by Mercedes-Benz rules. If they're American companies and they're over here, Apple has to play by our rules. So stop manufacturing all your stuff over there, putting low-wage workers at risk. Start manufacturing here in America, paying Americans good, decent, high wages with union membership. Do that over here. We do that by taxing the hell out of these companies.
Now, it's interesting because it does seem like the new global model is that nations are sort of secondary to multinational corporations. That global capital is really the new entity, the new powerful entity in the world. And that's been enabled by, I think, decades long shift. I mean, really since the 1970s or 80s in earnest, where this starts to take shape. And what you're proposing is sort of a radical counter to that, and more getting us back to our roots, I think, as an industrialized power. Obviously, you're going to face pushback. Obviously, you've got very powerful interests lined up against you. So what can ordinary people do to help put people like you in office?
Wake up, understand that the problems that they're facing in their lives didn't just materialize out of thin air. I mean, these problems they've been systematically stacked up and stacked up and stacked up over time. Right now, we're seeing folks who have lost their jobs, 10 million unemployment claims. Yes, folks don't have $500 saved for an emergency. I would say this constitutes as an emergency. But why is that? Because wages are stagnant. Because housing costs keep going up, healthcare costs keep going up, because manufacturing has been taken away. We're losing good union jobs every day. So understanding that, damn, all these things are tied to the people at the top who are in office, who make these decisions. That's why my life is like this. Because I'm a hard worker. I work hard. I go to work. I pay my taxes. Isn't that what the American dream is supposed to be? It says, hey, if you do these things, you'll get ahead. Millions are doing these things, but they're not getting ahead. So we have to look at the root of the problem. It's the system of capitalism as it exists.
Now you have an interesting background. You're a military man, and you are now actively retired.
Yes.
And disabled
Yes.
from your service.
Yep.
So I have to ask: does your disability make you more vulnerable to coronavirus than the
Yes.
average person?
I have a number of things that qualify me to, be disabled from the military. One of the things is pulmonary issues with my lungs from all the burn pits that I was around in Iraq and Afghanistan. So getting pneumonia for me would be really, really bad. I keep slowing down because I'm trying to take deep breaths and stuff like that right now. A lot of other things I deal with is PTSD and anxiety. So it doesn't help when I have trouble breathing to be diagnosed with PTSD and anxiety. It really doesn't help the situation. There's a lot of other things. The other things are physical injuries, but that pulmonary injury, pulmonary stuff in my lungs, and the PTSD and TBI really don't help the situation. But I shouldn't be outside, going outside. And my wife's immunocompromised, so she can't even leave the house, any of that stuff. So
the last time we talked, you told me about your wife.
Yeah.
You told me that she was the really the light of your life, and how
Absolutely.
she helped you out of a depression.
A really dark, a really, really, really dark place. You know what I mean? And like, I went to the hospital, so like, I have my mask. She's living in the room. I'm living out here on the couch. You know what I mean? I can't go talk to her, touch her, any of that stuff. I have, same fork I eat off of, same bottle I drink out of. Our apartment is very, very, very small. We live in a basement apartment. It's like a damn studio. So we're very separate. We're trying to stay as separated as we can possibly be. She uses the bathroom, and then disinfects it. I use the bathroom and then disinfects it. We're wiping our hands all the time. My wife she is the love of my life. She's a special person. She helped me through a lot of stuff that I was going through, and I love her for that. Always will.
So tell me about. So are either of you do either of you have to leave the apartment for any reason during the day?
During the day, no. I went a couple weeks ago and bought as much food as we could afford and stashed it around the apartment. So we try not to go out. Maybe I go out once a week if we need like food or more cleaning supplies, but that's it. Don't go anywhere.
And that's why you're isolating from your wife.
Yeah.
That's got to be hard.
Absolutely. It is. It sucks. It sucks. I mean, it does. But, we have to do what we have to do. We have to take this thing seriously. And I wish more people at the federal level were taking this seriously. Obviously Donald Trump isn't taking this seriously because there's so much more he can do. There's so much more he can do. Right now, New York has manufacturing. There's more stuff Governor Cuomo can do. There's more stuff all of our leaders can do. Bill de Blasio waited a week to shut down the damn schools. I asked my wife, I was like, why are we not shutting down the schools? Even when the school on Staten Island, they had somebody was infected. Oh, they're going to close the school and disinfect it. How many people were exposed to that infected person at that school? How many people took COVID and carried it around the 5 boroughs because they got it from a school or somebody who was infected because de Blasio didn't shut down the damn schools. You know what I mean? So these are things our leaders can be doing more. Hindsight is 2020. And when we look back on this stuff 2 years from now, 3 years from now, we're going to see a lot of failings of the system that did not need to be because people were not doing what they were supposed to be doing. Not civilians, those who are in charge, who are in leadership. Right now, I know essential workers have to get to work. But if you look at the buses, the doctors, all the experts are telling us stay 6 feet apart at least, right? You go into a bus, the front of the bus is blocked off. So only the back of the bus is open. How are you supposed to maintain social distancing when you got 15 people on the back of a bus? And those 15 people get off and they go their separate ways. Those 15 people might all be now infected, carrying the virus all over the different parts of the city they go to. We're defeating ourselves. We truly are. You know what I mean? So there's more that our leaders can be doing. I was a leader of soldiers in combat. I know it's a hard job. I'm not saying it's easy, but I had to make life or death decisions, to get my soldiers home in one piece. I get that. I've been there, done that, got the t-shirt to prove it 3 times on 2 separate battlefields. I get that it's hard, but just because it's hard, that's no excuse for you to not do the things that need to be done.
So, yeah, you obviously see parallels between your time in the military and what is going on now. Could we get into that a little bit? Could we talk about that?
Yeah, listen, we had disaster situations in the military. We had mass casualty events when I was in Iraq. We had one mass casualty event where a dump truck blew up in front of a Shiite militia, detonated a dump truck bomb in front of a Sunni mosque, killed 100 people, wounded like 500 others. This was in 2009 in Baghdad, not Baghdad, but in Taza, Iraq. We set up a cordon. We were on that site for days dealing with the wreckage. But we had leaders who understood, okay, X needs to be here, Y needs to be here, Z needs to be here. And right now, there's so many abandoned buildings across New York that can be set up for testing sites and hospitals and treatment facilities. Right now, I'm getting a little bit lightheaded, believe it or not. I'm talking so much.
No, it's okay. You can take a break if you need to.
So what I was saying is, I'm getting really, really lightheaded.
It's all right. Don't overexert.
1 second. This is the craziest thing I've ever been through, man. I've been through a lot. I've been through war. I've been through a lot of stuff. And this is just the not knowing all that stuff. So I finally went and did a test at I had to go pay for it at urgent care. And they told me it was because of my pre-existing condition that they gave me one, but the hospital couldn't do it. So we'll see what the results come back as.
When do you expect those results?
7 days.
7 days?
Like, yes. 7 days. So we'll see what the results come back as. But for now, for the time being, I'm assuming that I have it. That's why I'm out here, nowhere near my wife. For 7 days.
How much was the test?
It was like, I haven't got the bill yet. They don't tell you the bill, but I haven't got the bill yet. I don't know.
I from time to time or periodically, I go through GoFundMe just go to GoFundMe and I look at the medical fundraisers that are going on. Sometimes I'll share them. Sometimes I'll just look and, you know, take a screenshot of what I'm seeing. And I've already started to see an uptick in the number of COVID GoFundMe.
It's a shame. You know what I mean? Because, like I said, I went to the ER and they couldn't test me. This is the ER at the VA hospital, and they couldn't test me. We don't have widespread testing like the first young woman who came to see me at urgent care. She was a PA, and she wasn't going to test me. She didn't want to test me. She was like, "We don't have that many tests. We can't test you. Everybody in the waiting room is going to ask for a test. We're going to send most of them home." I was like, "What?" But you said if you want to test, if you need a test, go get a test. That's what the government's telling us. They don't have we don't have it. So she went out, she left the room for about 5 minutes to go talk to the doctor. And the doctor, because of my pre-existing conditions and stuff, the doctor was like, "All right, test him." But if it wasn't for my pre-existing condition, they would not have tested me. They told me straight up, they would not have tested me. They would just say, "Assume you have it, go home and self-care." So the drive-through test centers run out for tests. They run out of tests in an hour. We need to be doing a lot better than this, man. A lot better. Trump brags, we tested 1 million people. So there's still 326 million more to test. What the hell? We're not a nation of 5 million people. We're the third most populous nation in the world after China and India. It's the United States of America. Why do you think our cases are rising so high? Because look at the CDC advice. Now, after 2.5 weeks of the pandemic, they tell folks, "Hey, you should be wearing a mask out in public." We've known this for weeks now. Even if you're not buying N95 masks, covering your face in public. Leaders are supposed to give guidance and leadership. That right there was an absolute failure of leadership. 1/4 of the people can be asymptomatic and spreading the disease and spreading the virus and not even know it. So how many more people were infected because our leaders failed to give us the proper information? I mean, it's a damn travesty, man.
I mean, it's got to be frustrating for you because you are somebody who put their body on the line for this country, and even you had difficulty getting tested. You're somebody who is really, I mean, it took a lot. For some reason, my phone thought I said Siri. Sorry about that. But you're somebody who put their body on the line and gave a lot, sacrificed a lot, and even you had difficulty getting tested. I mean, what hope? Yeah. What hope does the average person have at that point?
I don't want to feel people to feel like it's hopeless, but we just need our leaders to do better. I can say that. If our leaders were doing better, like I'll give you an example. There are, the Prospect Park Tennis Center, that giant building. Those tennis centers are already up. The buildings are in place. They're closed. Those could be right now mobile walk-up testing centers right now, where folks can get tested right now, so they don't have to go to urgent care. We have biotech companies in New York. There are biotech companies all over the United States. Governors, mayors need to be reaching out. Listen, we need to order hundreds of thousands of tests right now. Start cranking them out. We need them ASAP so we can get folks tested and we can track this disease. It's not happening. It's really not happening. I don't want to give folks no hope, but we just need our leaders to step up and do more. There's more we can do. We need a national person who's in charge of this thing, not Jared Kushner. Don't put this idiot who has absolutely no idea how to handle a crisis or a pandemic in a leadership position. There are generals right now in the military who have led in terrible, terrible conditions. Why are they, when Hurricane Katrina hit, General Henry in New Orleans was put in charge of the recovery and the relief effort. Why haven't we done that right now? We have a hodgepodge of, well, it's Anthony Fauci, it's the Surgeon General, it's Jared Kushner, it's Mike Pence, it's who the hell's in charge? Who is taking the lead on this thing? Who's giving advice and orders on the direction of the president at this thing? We don't know. So all I can say is, brother, our leader needs to do better.
So then I wanna sort of shift gears, but also but ask you, do you think there was ever a way for the United States to truly be prepared for something like this, given the fact that we have a healthcare system where cost is a significant barrier for millions of people, and complexity too? I mean, if you go to a lot of people, they weigh, do I go to the doctor? It's going to be expensive. I'm going to have to deal with my insurance company. So there are a lot of disincentives for people to see a doctor when they're sick. And on top of that, as you mentioned earlier, we have stagnant wages. We have a reduction in spending power and employment tied to insurance. So a lot of people don't feel like they can take off work when they're sick. Number one, they need the paycheck. Number two, they can't afford to lose their job because their job is where they get their insurance from. And they might not even be able to use that insurance anyway because of the deductible. So do you think, I mean, with these things, with these factors, do you think that there was ever a world in which the United States is prepared when a novel coronavirus emerges in China and makes its way to our shores?
Yes, look at South Korea. They were prepared because, one, they took the warnings, they took the data and warnings from China seriously. They saw what was happening and they prepared for it. That's number one. Number two, we have the best CDC in the world. We have pandemic experts in all these things. Trump fired them and cut their funding. He fired the guy who was the attaché, I believe, to China to study infectious diseases. That person was not on the job, not through their fault, through the federal government's fault. We saw, and not only that, we had weeks to prepare for this thing. We could have been manufacturing ventilators 3 weeks before this thing hit our shores. Imagine, we'd have 30, 40,000 more ventilators. We could have been getting hospital beds ready. We could have been doing these things before. There's a way we could have been prepared.
Well, so something I've talked to several medical professionals about, a doctor friend, a nurse friend, is the fact that we don't have domestic supply chains for these items, and we have this culture where people don't seek treatment or or are unable to take the necessary steps they need to take when they get sick. So my question wasn't, is there a way for us to be more prepared? It was, do you think that this? See, I look at this and I think I look at it as sort of a warning that no matter how much we threw into preparing for this, at some point this was going to overrun us because of these things, because people can't take off work, they can't see a doctor, because we don't have the supplies. The supplies are made in China, and China is the first place that gets hit. So how do you get supplies from a country that's dealing with its own pandemic? I mean, do you think, and South Korea has a national healthcare system?
Yeah.
Do you think that the United States, with our current economy, the way that the economy is structured today, could have ever been truly prepared?
No. Especially not when we have 50 different hodgepodges of healthcare in 50 different states with 50 different sets of rules. We have employment, insurance tied to employment. We have stagnant wages. We have, poor living conditions. No, we could not have, not the way everything's structured. That's why we need fundamental structural change. Because if you look at it, these things are cyclical. They come back around and around and around. So we're going to get through this coronavirus pandemic. But the next one that hits, if it hits in 5, 10, 20 years, is it going to be bigger than this? Is it going to be worse than this? Are we going to be projecting 20 million American dead? We can't keep doing this. We have to have structural change in the entire economy. And it's going to be hard, but it has to be done.
And that's what you're running on.
Absolutely.
And it's personal for you.
I'm sitting here right now, short of breath as it is, bro. Right now. I mean, my head is spinning, but I'm still doing this interview. That's
Well,
why I keep taking
I'm glad
pauses.
that you are. And I do appreciate you taking the time and speaking with me.
That's why I keep taking pauses in between. Because it feels like I'm not getting enough oxygen.
So when you went
And
to
talk.
when
Oh,
you
go
went,
ahead.
sorry, but when you went to the hospital, you got out of the car. What was the first thing you noticed when you walked in?
The VA hospital is different. They have security guards and a metal detector and all these things. And they have like an x-ray machine conveyor belt. So first thing I noticed was they have a tent set up outside of the hospital where they take your temperature and your vitals before you walk in. So they do that, and then you walk in, put your stuff through the conveyor belt x-ray machine, and present your ID to the security guard, because you have to have your VA veterans ID to get in. And then they ask you where you're going, and they have a separate entrance for employees and patients. So if you tell them where you're going, they point you to the patient entrance, and you just walk in, go through the emergency room. The emergency room shut its entrance, so you have to go through the security entrance. And then you walk in, and everybody's masked up. The staff is masked up. The chairs are far wide apart, and then it's a normal procedure. You give them your last four, your social, last name, date of birth, and then you go on back into the emergency room. But back into the emergency room, it's everybody. It looks like a scene out of outbreak. People are nurses wearing masks and gowns and face shields and gloves and booties. And I've been to the emergency room for stuff before, but the nurse is just standing there with normal mask on and just gloves on, but not now. Now it looks like a biohazard thing. And I really was scared to go into the hospital. I don't want to go to the hospital because coughing folks are in there all day. You know what I mean? Then they put you in a room with other people, and one of the guys in the room was just. Luckily for me, I had a mask. But one of the guys in the room he was coughing up a storm, just hacking away. They didn't give him a coronavirus test either, because he was there less time than me, because he came in after me. And when I was walking out to get discharged later that day, he was sitting in the lobby talking on the phone. He's a veteran as well. He's like, they wouldn't give me the test. I'm like, what the hell? This dude was hacking up lungs, and they still, older gentleman, they wouldn't give him the test at all. And I remember distinctly hearing, I think he was on the phone with somebody to pick him up. He was sitting in the lobby, and he was, because I had to check out when I was leaving. He's like, they wouldn't give me the test. And I saw him, so I know what he looked like. And I'm like, this dude was just, the doctor, I overheard the doctor telling him stuff, was like, well, you're going to have to do this, you're going to have to do that, but you don't have a fever, so you can't test you. And I'm like, this thing is presenting so many different symptoms that a fever cannot be the end all be all metric for how we test people.
I was talking to a friend of mine who is a doctor, who was saying that it's not even fever anymore. It's like relative fever. It's if you feel feverish, that could be a symptom. So yeah, that's frightening. And I think that's an experience that a lot of people have anyway when they go to the doctor, is that they don't want to be there. They're anxious enough. I mean, I get anxious when I go to the doctor. But to add to that, the cost disincentive
think about it though. Everything they did to me that night, I got a chest X-ray, 2 chest X-rays, an EKG, a complete lab blood work, complete full. Cultures, urine samples, fecal samples, all that stuff. It's in an emergency room bed for 3-4 hours. If I had done that without insurance, that would have been thousands of dollars. Thousands of dollars. Not going to cost me a dime because I'm a veteran. Which is an incentive. It incentivized me to go to the hospital when I was feeling terrible.
That you could, knowing that you could go.
Yeah, exactly. Knowing that I can walk in there, show my ID, and they're like, all right, come here, Mr. James, come on back. But there's so many people right now who don't have insurance, who are at home, can't breathe, feeling terrible, praying to God, but can't afford to go to the ER because what they did to me last night, bro, that's $10,000 worth of work. Shouldn't be that way. Shouldn't have to be that way. At least. Listen, just the chest X-ray and the EKG is thousands of damn dollars, and taking up an emergency room bed. That's thousands of dollars right there. Had I took the ambulance from my house, my apartment to the VA, that would have been a couple $1,000s. You know what I mean? But that knowing that I was protected and covered, you know, that made me say, okay, I know I can go. Because a lot of people don't go because, you know, God forbid they have to go. When they get out, they're gonna have a $20,000, $30,000 hospital bill, and they can't afford that stuff. You know what I mean? And then to have a doctor call and check up on me, all these things, all that stuff costs money. And there are so many people right now in my district and across this country who can't go because they just can't afford to get a hospital bill like that.
Yeah, tell me about the demographic makeup of your district.
Hold on a second. Well, my district is one of the hardest hit in New York City right now with the coronavirus. The makeup is 50.5% African American. Yeah, I mean, we are a working class district. 10% Hispanic American, Latino American. So at 60% people of color. This district is 60% people of color. We have some of the poorest neighborhoods in Flatbush and East Flatbush, Crown Heights and Bed-Stuy and Brownsville. You know what I mean? And those people are hit the hardest. Only 1 in 5 African Americans are able to stay home and not work, to work from home. So all these folks are either they lost their jobs or they are essential workers. They're working at grocery stores. They're cleaners, they're nurses and all these things. And we've been hit the hardest because of that, because people have to go outside the house. Not only that, like I said, we're one of the poorest, we're some of the poorest parts in this congressional district. And when I remember telling my wife, when I remember back on March 14th, when the call came from the governor to shut down petition getting. And social distancing was starting to be a thing in California. And it was starting to be a thing in New York. But it wasn't being enforced. Driving down Flatbush Avenue, I'm like, look at all these people clumped together. Before it got as bad as it is now, I'm like, jeez, they're spreading the virus. And they're not doing it on purpose, but they're going to work. They're on the buses. They're on the train platforms. They're in the stores buying food. And I'm like, God, poor people can't afford Instacart. They can't afford HelloFresh. They can't afford, these delivery services that it's going to cost them $20 to get the groceries delivered when they only got $60 to spend on groceries. So these are luxuries that poor working people can't afford. Not only that, the homelessness in my district is some of the highest in New York City. What are our homeless brothers and sisters doing right now? How are they doing? Who's checking up on them? It pains my heart to know I can't go out there and check up on them. How are they faring right now? I see the same homeless people at the same train stations and the same bus stops every single year. What's going on with them? What's going on with the families that have the children are dealing with asthma in Crown Heights before this pandemic hit? People who are couch surfing, who don't have, stable places to sleep and live. Are they on quarantine? Whose house are they in? You know what I mean? Are they kicked out now? There's so many things in this district that folks are going through. And it pains me that I can't go out there and help them. But these problems persisted before this pandemic. And they're just exacerbated much, much more now because of it.
Yeah, that's like the Danny Glover's quote from New Orleans after Katrina, that it didn't create a third world country, it revealed one.
Yes, absolutely. I mean, income inequality is some of the highest it's ever been. You know, not unemployment, but stagnant wages and the lack that the people don't have enough to sustain themselves in an emergency is being magnified right now. Magnified. I keep touching my back because I have like body pain, so like the back of my neck, my back, all that stuff. That's why I keep shifting and moving all over. So I'm assuming I have it, but that's why I keep moving all over. It's just a sucky time right now, but we all have to push through it. You know what I mean? We all have to push through this stuff. And my drill sergeant told me something. I was a brand new private. He said the quickest way through a tough situation, straight through. So we can do nothing but listen to the advice of our leaders, even though some of them aren't doing their job. But there are those who are sounding their alarms and doing what they need to be doing. So we're seeing who our true leaders are, the Anthony Fauci's and the Governor Cuomo's. Even though he's done some sucky stuff, he's still leading during this crisis. Trump is inept. He's just not doing anything. Congress right now, most of them, for the most part, they're inept. They're not doing any damn thing. Oh, we passed a $2 trillion stimulus to bail out Wall Street and banks. We're out of here. What the hell? Imagine if your doctor came in and was like, boom, I got his heart started again. All right, peace. You guys fix this up. Be like, where you going, doc? He has to stay there and oversee the patient. That's what Congress did. They're like, all right, $2 trillion stimulus. We out. We're discussing the next rounds of the stimulus. We'll get your ass to work and get it passed. Get a bill drawn up. Get it to the president's desk. What are you waiting for? There's no time like the present. So there are some leaders who are doing the right thing, but there are some people in leadership positions who should not be there.
Well, Isaiah, I really do appreciate you taking the time.
No, thank you for having me, dude. We've been trying to set this up for a while.
For a while now.
Yeah.
The last time that I spoke to you was in your campaign office.
It was, which I haven't been in now in over a month.
Are you still paying rent on it?
Yeah, I am. They just took the rent out of the campaign account. The first. Unreal. Yeah, I'm still paying rent on it. Haven't been inside there. Haven't been inside that building now month. My entire campaign office with all our campaign literature and maps and strategy in it. Haven't been in there. Been talking to my campaign manager via phone and Zoom meetings and my whole team. Haven't seen them physically in almost a month. Can't be near them. Yeah, still paying rent on the campaign office.
Unreal.
Yeah, that's why we need, donations. Like I said, I feel terrible asking people to donate to my campaign in the midst of a pandemic. That's why I haven't really been putting out calls on Twitter or Facebook or Instagram like, hey, donate, because it just feels craven. It feels, self-absorbed. Like there's much bigger things right now than just me and my campaign. You know what I mean? And I had to come to the realization of that. You know what I mean? There's folks out there, hey, donate if you can, give us money. Listen, take care of yourself. Take care of your family. If you need that money for something else, by all means, use it for that. You know what I mean? My campaign is such that I'm fighting for people. Win, lose, or draw, I'm going to still be fighting for people. And guess what? In 2 more years, we get right back at this thing if I don't win. But as of right now, what we're doing, the campaign is still going on. If folks are able to donate, by all means, they can donate, at our website, isaiahforcongress.com. But if they're not able to donate, by all means, do not feel bad, because I'll be the last person that you will offend by this, because the situation that we're in this country right now, you have to take care of your family. You have to take care of your household and your needs first before even looking at a congressional campaign.
Well, best of luck to you. Sorry, I had myself muted because
No, you
there's some movement on this end. But best of luck to you, and I really do hope that you feel better soon.
you and me both, man. Listen,
Yeah,
I don't like you and me both.
it's just,
I,
gotta look out for ourselves. Got to take care of ourselves. The help is not coming from on high, so you gotta just do it yourself, man.
but we shouldn't have to, not in this country.
Of course not. Of course we shouldn't have to. It's just that's sort of, I have to say I do feel like
Every ventilator that's needed, we already paid for. Called
right.
taxes. Every hospital bed that's needed, we already paid for that. We pay 8.5% city tax. We pay state tax. We pay federal tax. And you sons of bitches telling me we ain't got enough hospital beds? Shame on you. What the hell you been spending my money on? Oh, you've been spending it on tax breaks for corporations. You've been spending it on billionaires and millionaires. What the hell? How dare you? We've
And
already
war.
paid you for this. Exactly.
And
We've
wars.
already paid you for this. $790 billion on defense. Can an F-22 now shoot the virus? No, it can't. You damn idiots. We needed that money for people, not for bullets and bombs. We should have been putting that money into a social safety net, and we wouldn't be asked out right now. But let me not get excited because I'm gonna start going off.
All right. Well, you have a great rest of your day, and
Thank you, man. You too.
do feel better. Keep us posted. On
Stay safe. Please stay in. Everybody, if you do not have to go out, stay inside. Stay inside. If you have internet, there's an entire world out there for you to see on the internet. Read a book. Write a book. Damn it. Write down your memoirs. Do something. Don't go out of the house.
Take care, Isiah.
All right, man. Thank you. You too.